Okay, hi. We're going to talk about excitotoxicity, excitotoxins, and how to avoid them and how they are associated with cognitive decline that is largely avoidable. Okay, to start out, here's the basic structure of an amino acid. There's like an alpha carbon in the center, and then you can remember an H above it, like H for hydrogen, H for your head, and then your arms out like there's a right and a left arm. There's a carboxylic acid on one side there, the COOH, and there's a amino group there, so that's why it's called an amino acid. It's got an amino on one side, it's got a carboxylic acid on the other side. And then the R is for the R group. And that is the typical structure of an amino acid. The one we care about the most is glutamic acid, because glutamic acid, or glutamate, is the most important neurotransmitter in the brain. Depending on what you read, in the ballpark of about 80% of brain neurotransmitters. When the hydrogen ion is removed, then it becomes deprotonated and it becomes pronounced glutamate. So glutamic acid and glutamate for our purposes are essentially the same thing. Okay, the side chain, the R group here, there's 1, 2, 3 carbons, and so that would be like propane with a carboxylic acid on it becomes propanoic acid. So the R group is propanoic acid. And then aspartate is also an excitatory amino acid. Excitatory means that it stimulates the postsynaptic neuron to want to fire an action potential. It raises its resting membrane potential and depolarizes it. Okay, so the R group for aspartate is ethanoic acid because there's 2 carbons. Like ethane would be the alkane with 2 carbons. So 2 carbons is ethanoic acid. It's also called acetic acid. And it's very similar to the structure of glutamate. So I'll even call it baby glutamate. So those are the 2 important amino acids for us to be aware of, and they're both excitatory neurotransmitters. Okay, now we're going to talk about the synapse in the hippocampus. The hippocampus is the memory center of the brain. So the first neuron over here is the presynaptic neuron. The space between the 2 neurons is called the synaptic cleft. 2 neurons connecting to each other is called a synapse. This is how neurons talk to each other. Okay, first of all, we got to talk about the plasma membrane of this neuron over here. Now, the first thing we have drawn is a KN ATPase. For our purposes, our convention will be we'll put the electrolyte that's going into the cell, we put that first. So that's why the K comes first. K is for kalium, like Latin for potassium. So the potassium is being pumped into the cell, and then the sodium is being pumped out of the cell. So that's the KN ATPase. It's called an ATPase because it uses up an ATP. The ATP releases a phosphate and it becomes ADP, adenosine diphosphate. And notice that there's a difference in the number pumped. There's 2 potassium pumped in and there's 3 sodium pumped out. And so what that means is that you have an accumulation of a net negative charge inside the cell because you're pumping out more positive charges than you are pumping in positive charges. So there's a net effect of positive charges leaving the cell. So the resting membrane potential of a typical neuron is about negative 65 millivolts. All right, and now the individual cell has tons of these KN ATPases. And that's, again, that's potassium sodium ATPase. And the reason it has tons of them is because it establishes a resting membrane potential. And that resting membrane potential is now a strong gradient that the cell uses like a battery, energy to do lots of other things. So there's a gradient that's called an electrochemical gradient because you have sodium accumulating outside the cell. So the concentration, there's a lot more sodium outside the cell than there is inside the cell. It's about 140 outside the cell relative to about 14 inside the cell. So what that means is based on its concentration gradient, ions like to equilibrate and be equal on both sides of a membrane if they can. The sodium wants to come into the cell to equilibrate its concentration gradient. In addition, because the charge inside the cell is negative and sodium is a positively charged ion, it wants to come inside the cell because it seeks that negative charge. It's attracted to it. So there's the electric gradient of the charge and there is the chemical gradient of the sodium concentration. And an average cell anywhere in the body will use in the ballpark of 1/3 of its energy to maintain the KN-ATPase. It does a little bit of work with it, but the neurons do tons and tons of work with this KN-ATPase. Approximately 65%, same as our number for our resting membrane potential here, of the neuron's energy is used to run the KN-ATPase. And an example of what it does with it, right next door here, we have the NACA exchanger. So NACA stands for Na, sodium, Ca, calcium, exchanger pump, okay? And when you use ATP for something, that's called primary active transport. And then because the NACA exchanger is dependent on the sodium electrochemical gradient, this is called secondary active transport. But the real energy, like we're saying, it's coming from the KN-ATPase. So what's done here is 3 sodiums are brought into the neuron, and in exchange, the calcium is pumped out. And by the way, the reason we're going all over all this stuff is because excitotoxicity is an essential key mechanism for causing brain damage. It causes cognitive impairment in young people, cognitive impairment in old people. This is a major, major cause of brain damage, and it relates to mood disorders. And basically, when you understand it, again, it's easy to avoid most of these things, almost all of them. So what I'm trying to say here is the knowledge gained from these concepts here is really valuable. It's really valuable to your health. Okay, so the key point was that the NACA exchanger is entirely dependent on the KN-ATPase establishing a strong electrochemical gradient, which it does with the sodium. And so then you harvest the gradient, in a sense, by bringing in 3 sodiums and pumping out the calcium. Now you might ask yourself, well, isn't that going to dissipate the gradient if we're bringing in 3 sodium and we just pumped out 3 sodium? The reason that doesn't happen is because you got a lot more KN-ATPase than you do NACA exchangers, okay? One thing too you'll hear about down here is a PMCA. That's the plasma membrane calcium ATPase. That also can pump calcium out of the cytoplasm, but it's very slow. That's a pretty routine pump in the average cell, but in an excitable cell, like a neuron or a skeletal muscle, where there's a lot of ions moving very quickly across these membrane ion channels, you need something much faster. This pumps, I think, about 150 calcium ions per second. This is about 5,000 calcium ions per second, so it's incredibly fast. And again, the NACA exchanger is totally dependent on the KN-ATPase establishing a resting membrane potential of -65 millivolts. All right. The next thing we'll talk about right here is GLU. GLU is for glutamate, and that's our neurotransmitter here. So you have, within the presynaptic terminal, you've got these neurotransmitter vesicles, which when signaled, they will travel to the plasma membrane of the synapse, and they will then diffuse across the synapse and stimulate the postsynaptic neuron receptors, okay? The first receptor stimulated up here is called the AMPA receptor. The AMPA receptor is a sodium channel whereby the glutamate neurotransmitter binds a sodium channel, and that allows sodium into the postsynaptic neuron. Now, the resting potential of the postsynaptic neuron is also about -65 millivolts. And notice that's a negative charge. So because of that, the positively charged magnesium wants to get into this cell. It tries to come in through the NMDA receptor here, but it gets stuck binding in the center of the NMDA channel. And that's a very good thing. The magnesium is blocking the NMDA receptor, and it's preventing calcium from coming in while the magnesium is in place. However, once the AMPA receptor lets in enough sodium, you'll get a partial depolarization to -40 millivolts, and when that happens, now you get opening of these VGNACH. Now, what does that mean? That means voltage-gated sodium channels. Now more sodium rushes into the cell, because that sodium, it wants to get in. It's got an electrical and a chemical gradient to drive it in. When that happens, the sodium depolarizes the membrane potential. Instead of being negatively charged, it becomes positively charged. It goes up to about +40 millivolts. And the relevance is, once that happens, now the magnesium says, well, forget this. There's no negative charge for me to be attracted to, and it just walks away. So here, like a story, we've got, so think of this as being, while it's still negatively charged, and over here on the other side of the NMDA receptor, the magnesium says, forget it, no negative charge, nothing, waste of my time. And the magnesium then diffuses out of the NMDA receptor. Glutamate is here bound to the NMDA receptor. Also, glycine binds to this receptor as well. That becomes relevant because there's some herbicides that mimic the structure of glycine, which is another reason why I recommend eat only organic food if possible. What else is happening here? The glutamate has now activated the NMDA receptor, and now calcium's coming into the cell. Now, glutamate is the most common neurotransmitter in the brain, and it is normal for some calcium to come into the cell. So if there's just a reasonable, normal amount of calcium coming into the cell, like when you're learning something, NMDA, you have a quick insight or an emotional moment, that receptor will open up, and that's part of the mechanism of memory. It's called long-term potentiation via calcium entry into the postsynaptic cell, and it'll cause an action potential to fire in the postsynaptic cell. However, if you have an unnatural overstimulation of this postsynaptic neuron, too much calcium coming in because you're stressed out, the corticosteroids increase the amount of glutamate coming across the synaptic cleft. If you're sleep deprived, that mimics the same thing as stress. More corticosteroids, more glutamate coming across the synaptic cleft. If you're drinking caffeine, that will also cause more glutamate across the synaptic cleft. Other stimulants, amphetamines, cocaine, for example, more glutamate coming across that synaptic cleft. Not a good thing. And then the postsynaptic neuron has to deal with all that intracellular calcium. Intracellular calcium is like a light switch. When that comes in a high amount, it activates the postsynaptic neuron to depolarize, send an action potential all the way down its axon. And so when there's too much of it, it overstimulates the postsynaptic neuron. That's why it's called excitotoxicity. And when it's present in really large amounts, you get really high postsynaptic neuron calcium, that neuron is at high risk to die. It can overextend its metabolic resources, and it'll go into programmed cell death called apoptosis. So how does the postsynaptic neuron compensate? Well, it does a couple things. Like we spoke about earlier, it tries to run its knockout exchanger as fast as it can, get that calcium out of the cell. Because calcium, C for calcium, C for contraction in a muscle, and it activates things. When calcium's in there, the cell works very hard to keep calcium out of its cytoplasm because calcium is a big deal. All right, so it tries to run its knockout exchanger, and hopefully it can produce enough ATP to do so. The mitochondria down here is cranking out as many ATP as it can and trying to keep up. When it cranks out such a large amount of ATP, it's also going to be generating more reactive oxygens, causing some oxidative stress. So how can that postsynaptic neuron survive? Well, it has a couple mechanisms. One of them it has something here called a SERCA. SERCA stands for sarcoplasm endoplasmic reticulum calcium ATPase. Now in muscles, it's called the sarcoplasmic reticulum, but in a cell like our neuron, it's just an endoplasmic reticulum. And the bottom line is it's a reservoir, a bag where you can store calcium to get them out of the cytoplasm. And there's a lot of things that inhibit that SERCA. Sarcoplasmic reticulum, endoplasmic reticulum, calcium ATPase. There's a lot of things that inhibit it. So all of those things increase the risk of excitotoxicity. So if the calcium is very excessive, one theory is that it can activate something called calpain, which is kind of an amusing name because cal as in calcium, pain as in something painful, bad. It can destroy the knockout exchanger. There's other mechanisms. There's actually multiple other mechanisms whereby this postsynaptic neuron is damaged by the excess of cytoplasm calcium. When you hear intracellular calcium, what's usually referring to is cytoplasm calcium. Okay, it's the cytoplasm calcium that causes problems because storage in the endoplasmic reticulum can be normal, and there's some storage of it in the mitochondria as well. But you can see here that anything that damages the mitochondria is going to hurt this neuron because the neuron needs tons of ATP to run the KN ATPases and the knockout exchanger and the SERCA pump. So you need those mitochondria functioning well. Notice how the magnesium blocks the NMDA receptor. And that's another reason why it calms down the neuron. So M for magnesium, M for mellow. Rest is good. The neuron needs to rest. It only needs to be active when there's something going on. Okay, I remember C for calcium, C for contraction. It's coming from skeletal muscle, and that's how it causes, and smooth muscle, and that's how it causes hypertension. But this is a really key diagram here. This comes up, this pattern here of excitotoxicity, it will come up a lot. If you become interested in the brain and optimizing cognitive function, minimizing risk of dementia and neurodegeneration, this is a key picture here. This is actually a whole bunch of stuff summarized in one picture. Okay. Okay, here are excitotoxin potentiators, things that increase the risk of excitotoxicity and damage to the hippocampal neurons, the postsynaptic neurons, if there's a sodium excess. The body needs to maintain a balance of positive ions. Positive ions are called cations. They're called cations because they're attracted to a cathode, okay? I remember a cat, like a cat purrs, P for positive ion. That's another way to remember cations are positive. But the point is, when you have an excessive amount of sodium, your kidneys will urinate out more of your potassium, so it makes things worse. And, our anthropology, humans, thousands of years ago, ate tons of potassium and relatively little sodium. But in the modern diet, with all this processed food, people are eating like 10 to 15 times more sodium than potassium. So they're screwing things up compared to what they're designed to eat. And that's a major contributor to why so many people are hypertensive. But the point I'm making here too is hypertension is not just high blood pressure. It means that there's abnormal ion levels in every cell in one's body. It's a big deal. Okay, so that's another reason why I think it's a really good idea to try to get that sodium down. Plus, you can compensate to some extent by having higher potassium dietary intake. And there's a lot of P for potassium, P for plants. If you look at a lot of plants, you'll have like 20, 30, 40, 50 to 1 more potassium than sodium. That's another reason why they're so healthy. Sodium is a vasoconstrictor. Potassium is a vasodilator. It opens up your arteries, which improves blood pressure. And the reason why it's such a big deal is if you get high sodium and low potassium, you'll start to dissipate your electrochemical gradients. You'll get more sodium coming into the cell. And the weaker that gradient, the less the individual cell is able to pump out its calcium. So you weaken the cell's ability to do its job. And as it turns out, that electrochemical gradient of sodium is also coupled to pumping protons out of the cell, managing the acid-base status of the cell, and it's also related to transport of some amino acids across the plasma cell membrane. So it's a major energy system of the cell. So you don't want that messed up. That's one of the reasons why I'm such a big believer in reducing dietary sodium, because every single cell in your body, especially your brain, is very dependent on this ratio of potassium to sodium. You want your potassium intake about 5 or 10 times higher than your sodium intake. Okay, the other thing is magnesium. I'll show you a picture of it in just a moment, but magnesium is bound to ATP because you got all those negative charges on the phosphates, and it helps neutralize that effect so the phosphates don't repel each other and come apart. I'll show you a picture of it in just a moment. Okay, next thing is glutamate excess. We talked about that. You get increased glutamate being released across that neurotransmitter by being stressed out because of high cortisol. Same thing with caffeine. Dietary excessive intake of MSG is thought to do something similar. MFG means manufactured free glutamate, and that's a very common thing now in the process. So we had a lecture just a couple days ago about recognizing MSG, manufactured free glutamate in food. Sleep deprivation does the same thing with the hormones of stress and caffeine. Other excitatory amino acid that can function as neurotransmitter include aspartate. We just looked at the chemical structure a moment ago. L-cysteine can also do it. Next thing is SERCA inhibitors. So that's our sarcoplasm, endoplasmic reticulum, calcium ATPase. There's a lot of things that inhibit that. A good book about that was The Calcium Connection by Brundy Brody. A good book about sodium and ion pumps would be The High Blood Pressure Solution by Richard Moore, MD, PhD. Okay, so getting back to SERCA inhibitors, lead can do it, mercury can do it, other things, lots of things can do it. Hyperglycemia from diabetes, preservatives, BHA, BHT, other preservatives. These food dyes can be harmful to SERCA. Red number 3. So that's why I'm saying processed food, it's like a poison. You don't want to be feeding that to yourself or to your kids. It's a serious business. It impairs brain function, and all these little things add up. Because a lot of people think, oh, well, a 1% effect, who cares? Well, it's a question of your standards. I mean, if your standards are, at least I'm not as fat as my cousin, well, then you're not going to notice much of a difference with these things. But if your standards are, what's the best I could do cognitively, physically, then you really want to optimize everything. Plus, you want to push any type of cognitive impairment so far into the future. You don't want to be demented and, mentally stupid as you get older. Okay, so these food dyes, some of them can do it. Red number 3. Okay, some of these other herbicide chemicals, some of the chemicals in sunscreen, And that's one thing I'm a big believer in, is be a minimalist. Don't be rubbing chemicals on yourself. So many people, they love chemicals. Now, if you ask a person, they will say, no, I don't love chemicals. They're rubbing a moisturizer on, then some sunscreen, then some perfume. Then they got all these cosmetics, then there's a conditioner, then there's a shampoo. You know, you rub all these chemicals on yourself. Some of the stuff is transdermally absorbed, and I almost guarantee you it's going to have estrogen preservatives. And then these cleaning chemicals are kind of toxic, especially with dry cleaning like TCE. Flame retardants, don't use flame retardants on your furniture or your clothing if you don't have to. PCBs, like in some fish, for example. Cadmium is more common than people realize. Aluminum, you know, the estrogenics like BPA, atrazine, and other ones. Anything that smells bad usually is bad for you. The paints, the glues, bleach. Filter your water, get the chlorine out of there. Don't be drinking alcohol. All right, so these are just some of the things. Okay, hypoxia will make it worse, because if the neuron's hypoxic, then it can't make ATP. When you make ATP through the mitochondria, you're making, let's say, 36 ATP per glucose. That's a lot, okay? If you have to run your metabolism anaerobically, you're only making about 2 ATP per glucose molecule. So the cell will not be able to counteract the effects of excitotoxicity if there's simultaneous hypoxia, and you're going to lose brain neurons. And that's one of the reasons why sleep apnea is such a big deal. When the person has obstructive sleep apnea, OSA, they're dropping their oxygen sats quite often at night. You do a sleep study on them, they'll be dropping their pulse ox for variable amounts of time, sometimes prolonged, let's say into the 80s. Well, now that neuron's hypoxic. If you simultaneously combine that with the person who eats a high-fat meal, they're going to drop it even more. Smoke a cigarette, drop it even more. So you don't want that. And it's another reason why I'm a big believer in minimize dietary fat as much as you can. They've shown people have been fine when they only have 0.7%, less than 1% dietary fat. That was the WINET study with linoleic acid, the omega-6 essential precursor, you know, C18 with 2 double bonds. And the point I'm making is our dietary needs for fat are much lower than is widely recognized. So that's another reason why I don't take any type of fat or eat any type of fat. I don't have to. You get enough in just the plant foods. And I want to minimize any of this rouleau. Now, if you look at the work of Pritikin and McDougall, they believe that the dietary fat's a stronger contributor to hypertension than is the sodium. But I can tell you, not everybody sees it that way. And I actually think sodium is a major contributor to hypertension. And that's based on the work of Richard Moore, based on the work of Walter Kempner and others. Okay, what else potentiates excitotoxicity? Hypoperfusion. And now hyperperfusion is much more common than people realize. Congestive heart failure, they're often underpumping blood to their brain. Atrial fibrillation, it's not just the clot and the embolus to the brain, it's the lack of the atrial kick to maximize left ventricular filling with the subsequent decrease in the amount of blood pumped to the brain. Lots of old people have aortic valve disease. You know, see calcified aortic valves every day, heavily calcified aortic valves every day, and they're getting less blood to their brain potentially, okay? Hypertension when it's overtreated. That's another thing about hypertension. One of the reasons why, if you can, you optimize your diet. Maybe you can come off your meds, let your body's own internal sensors regulate it, and you got to be careful not to overtreat it, because if you overtreat it, you're dropping your pressure. If you undertreat it and you're up over systolics over 160, you're potentially going to have increased risk of intracranial bleeds. But if you overtreat it too low, you run the risk of chronic cerebral hypoperfusion. Atherosclerosis in the carotid arteries, that can decrease when it's severe. People can have intracranial atherosclerotic stenosis. Again, those are thought to be most common from sodium, like in the Asian populations, where, like Japan, for example, in the 1960s, where they had a very high sodium intake, they would have more intracranial atherosclerosis. Because they had a relatively low-fat diet, they didn't have that much coronary artery atherosclerosis. So it was a little bit different than the typical pattern in this country, where they tend to have a lot of coronary and carotid atherosclerosis. Hypoglycemia is a big problem for the brain, because the brain needs that glucose. It runs on glucose. It wants glucose in order to make all its ATP. So when the brain is hypoglycemic, if it's simultaneously, let's say somebody eats a real sugary meal, drinks something, an energy drink that's got a lot of MSG and a lot of simple sugars in there, they might get rebound hypoglycemia. And during that rebound hypoglycemia episode, they now have the overstimulation of the neurons from the glutamate with the simultaneous drop in the blood glucose availability due to the rebound hypoglycemia. Rebound hypoglycemia is also called reactive hypoglycemia, whereby the sugar comes up so fast, pancreas overcompensates, insulin comes real high, drives the sugar down too fast, and then the person senses that low blood sugar. But if you're asleep, you don't sense it. And being asleep and having a low blood sugar is a real problem for diabetics. Now that there's a continuous glucose monitor they can put on their body, they're finding that some of them are giving themselves too much insulin. They didn't used to check their sugars at night, and they're becoming hypoglycemic at night. So again, they're putting themselves at increased risk for brain damage. And there's tons of people cognitively impaired. It's so common, it's not even funny. And that's one of the reasons why a lot of people notice when they first talk to the doctor talks really slow and professional. Hello, how are you? Because doctors spend a lot of time talking to cognitively impaired people. And a big reason for that is cognitively impaired people also have a lot more illness problems. Alcoholics get sick a lot more often. Drug addicts get sick a lot more often. Demented people, they're constantly falling down. The brain's more important for walking around than it is for thinking. And cognitively impaired old people are falling all the time. A bunch of them come to every hospital every day. Okay, this one I should have made the picture fit better. But anyways, here's the point on this. Here's ATP. Here's the adenosine. I don't have the ribose group in here, but anyways, here's adenosine triphosphate with 3 phosphates. And you can see the phosphates are surrounded by oxygens. All right, and the oxygen down here has a negative charge on it. Oxygen over here, negative charge, negative charge. So these negative charges repel each other. And what keeps them from repelling each other and the outer phosphate from just popping off is that there's a magnesium connected to it. And the positive charges of the magnesium help to neutralize the negative charges of the oxygens on the phosphate. And that's relevant because wherever you have an ATP involved in a reaction, you also have a magnesium. So the point I'm making here is magnesium is coupled to the KN ATPase of the plasma membrane of the neurons. So there's always magnesium. And why is this so relevant? Because the most common nutritional deficiencies in this country are fiber, potassium, and magnesium. Guess why? It's obvious. Because most people don't eat hardly any plants. The average person in this country eats about 90% of their calories from meat and processed food and oils, and they only get about 10% of their calories, if that much, from plants. So they are deficient in everything that comes primarily from plants: potassium, fiber, and magnesium. And that's a big part of why they're so sick, because processed foods and the meat and the oils are real high in fat. So there goes, that causes atherosclerosis and all these other problems, okay? All right, we talked about the electrochemical gradient being a battery for the cell, C for calcium, C for contraction, okay. Okay, some things associated with excitotoxicity. It's also with the person's mood, food and mood. When you have increased dietary sodium, it'll have an effect to increase activation of the sympathetic autonomic nervous system, SANS. And that is also associated with increased hypertension. For multiple reasons, sodium will increase blood pressure. And when you activate SANS, you'll have a tendency to cause some insulin resistance because you have elevated cortisol and catecholamines, which drive up blood sugar. And they also drive up blood lipids, which causes insulin resistance. These can cause a bit of a mild excitotoxic effect, can contribute to a sense of anxiety. They can cause insomnia that's associated with headaches and migraines. When excessive, PTSD, post-traumatic stress disorder. This is all part of that same pattern. So a lot of people will notice when they switch from the typical standard American diet, junk food and meat, to eating a vegetarian or better yet a vegan diet, their mood improves. They're more calm, they're more mellow, they sleep better. Their family notices they don't get upset so easily. Okay, what else? When excitotoxicity is becoming severe, it can damage the arcuate nucleus of the hypothalamus, which is where the hunger center is. And so in children with this, they used to put MSG in baby food. And for other reasons, a person could have excitotoxicity as a young person when they don't have that good of a blood-brain barrier. It's associated with lifelong obesity as one potential risk factor, according to some research on the subject. Babies and elderly persons tend to have less well-formed. Babies, just because it hasn't matured yet, their blood-brain barrier. Elderly people often have a damaged blood-brain barrier in some locations due to small strokes. Also, there's circumventricular organs around the third ventricle of the brain that lack a blood-brain barrier because they're chemoreceptors. And excitotoxins can get into that area a little bit. When you get a loss of hippocampal neurons, and this is gradually continuing over decades, you get a progressive cognitive decline and dementia. You know, in this country, people think it's just normal that your brain slows down and doesn't work so well when you're older and you become stupid. But it doesn't have to be that way. There's plenty of people who did extraordinary things in their 80s and 90s intellectually. And people are perfectly capable of maintaining all their sharps even into their hundreds. Like I said, they sent American physicians over to Okinawa, the Wilcox brothers, Wilcox MD and then Wilcox a PhD, to work with the Japanese physicians evaluating the Okinawan centenarians. And they found a lot of them, there was nothing wrong with them. They couldn't find any problem wrong with them. So we're perfectly capable of keeping an optimal, good brain function into our elderly years. There's been a lot of people who wrote great books when they were in their 80s or 90s even. Okay, I've also noticed, I read a lot of books, I'll see some writers, they're really good in their 50s, and then in their 60s, they're kind of like mentally slower, their 70s, so I'm like, wow, don't want that to happen. So anyways, yeah, and how important is this system? If a neuron's using 65% of its energy for the potassium sodium ATPase, that means as far as that neuron is concerned, it's the most important thing. 2/3 of their energy is devoted to it. You don't want to mess with that. So what I'm saying is hypertension is not just high blood pressure. It means that there's a sodium problem in every neuron in your brain. So it's a good idea to try to optimize that. Sodium's no joke. This is one area where I actually disagreed with Pritikin. Pritikin, you know, of course Pritikin didn't have all this information available to himself. Pritikin's a genius, okay? But what I'm saying is I don't believe, like even the low salt diet nowadays, they'll say 2,000 milligrams a day of sodium. No, I don't agree with that. The Yamamamo were about 200. So I would say, you know, I want to keep it 200 to 500. Keep it kind of low. And I don't count it, or I just don't eat any processed food. Zero. I don't put salt on my food. If there's a little salt in there, grandma put a little salt, fine, I'll eat it. But I don't go looking for the salt shaker. Okay, just a quick question here. Why does a cell have both NCX and a plasma membrane calcium ATPs? And that's just because we did already briefly mention it. The plasma membrane calcium ATP pump is slow, and all cells use it. Only about 150 calcium ions per second can be pumped out. The NCX is super fast. So cells that are excitable, like neurons and muscle cells, skeletal muscle, smooth muscle, cardiac muscle, they need to pump calcium out fast. 5,000 calciums can be pumped out per second. What electrolyte ion concentrations are present in the blood and extracellular matrix, ECM, or inside the cell? This is what we talked about. The sodium electrochemical gradient typically is about 140 outside the cell, 14 inside the cell. So it wants to equalize this tremendous gradient, tenfold gradient. And it's like the opposite gradient for potassium here. It's about 4 outside the cell. And like when you do a blood test, you're going to get a sodium on the blood test of about 140. You're going to get a potassium on the blood test of about 4. Inside the cell, the potassium is about 150. Now, if you look at the calcium, calcium has an incredible gradient. So we saw that for sodium and potassium is about a tenfold gradient, inside versus outside the cell. For calcium, it's like a 10,000 times gradient between the calcium amount outside the cell versus the calcium amount inside the cell. So this is millimolar concentration, nanomolar concentration. Okay, so how does a person avoid excitotoxicity? Well, P for plants, P for potassium. Plants have tons of potassium. If you look at the nutrition labels, this is actually a good way to tell real quick if food is good or not. Look at the nutrition label and you'll see tons of potassium in any true plant food and very little sodium. The numbers are huge, the differences. Anything that's got, if you buy some processed food, I would recommend never eat processed food. But if you're going to buy some, look at the sodium-potassium ratio. And if you see more sodium than potassium, throw it away. You don't want to eat it. But that's usually a very telling sign that something is highly processed, much more than it might give the impression on the front cover of it. Again, I only eat stuff that's just one ingredient. This is an apple. This is a pear. This is a blueberry. These are peas. These are beans. This is rice. You know, just simple, clear things. This is a potato. This is a sweet potato. There's no ingredient list. It's just one thing. whole plant foods. If you look at a chlorophyll molecule, the chemistry of it, right in the center is magnesium. So you get lots of magnesium and potassium by eating plant foods, and you get lots of dietary fiber, and you get hardly any sodium if you don't add any. I don't eat anything out of a can. Stuff in a can tends to come with a lot of sodium, and it'll have a BPA lining and an aluminum on the inner surface of the can. I don't want any of that stuff. Okay, number 4, avoid sodium. We talked about that. Eat a low-fat diet so you avoid the rouleau formation where the RBCs are all stuck together because of the fat, either because of the LDL cholesterol or because of the oils. And that induces hypoxia. Hypoxia increases the risk of cancer, you know, the Warburg effect. It also makes the blood thick, like a milkshake instead of like water. Blood pressure has to come up, causes hypertension. And it also causes insulin resistance because it gets into the skeletal muscle faster than does the glucose after you've just eaten. And so that causes insulin resistance, predisposes to diabetes. Metabolic syndrome is really insulin resistance syndrome. And it also causes atherosclerosis because of the combination of all the excessive fats and the high blood pressure. So basically, Pritikin had a great term for this. He called it lipotoxemia. Basically, and he said, fat is bad. And that's pretty much what it comes down to. When you really start to study fat, just spend some time studying fat. You're going to go, crap, it increases your risk of cancer, of high blood pressure, of diabetes, of dementia, of excitotoxicity. Bad. You know, where's the good thing? And that's why I'm not a big believer in, you know, good fats. I think that just is a trick word to make a person start eating all the junk of the Mediterranean diet, making themselves fat and sick. Okay, I recommend no meat, just because also you're not only just trying to be healthy for the future, your body needs to heal from all the dietary and other mistakes you made earlier in your life, so it needs to detox a bit. Meat also has lots of iron in it because it's heme-bound iron, which is absorbed at a much higher rate than plant iron. And so because of that, as you get older, you tend to be iron overloaded, especially men because they don't menstruate. So a woman at least, you know, is getting rid of some of her bodily iron up until she hits menopause in her 50s. But guys tend to be quite iron overloaded, and eventually that'll start contributing to oxidative stress. That's a topic for another day, but iron overload syndrome is a major contributor. People in this country tend to be estrogen overloaded from all these exogenous estrogen preservatives they absorb from their food and other sources, transdermal and whatnot. And so all these things start converging to destroy their health and make them demented, fat, and stupid as they get past 50 years of age. But again, they're all avoidable. That's the good, great benefit of learning this stuff. You can avoid almost everything. You're going to age a little bit anyways, but you can age well and be physically fit, mentally sharp and strong all the way into your 90s. That's what you want. Avoid caffeine. We talked about that. Avoid alcohol. Avoid tobacco. Manage your stress. Learn how to just, you know, let little stuff go. Have whatever a purpose in life makes you resilient. You know the routine. If religion or faith helps you, then that can be a good thing. Get your sleep. Filter your water to get the chlorine out, for example. That's a SERCA inhibitor, and there's other stuff in there, all the estrogenic chemicals and other things. Exercise also improves SERCA function. You know, go figure. I think it's because the brain's largely made for movement. And whatever happens in the muscles to some extent happens in the brain. Just as you store more glycogen in your muscles from exercise, you store more glycogen in your brain too. You also will activate BDNF, brain-derived neurotrophic growth factor. So what's good for the muscles in terms of general health, you know, getting exercise is good for the brain as well. Avoid things that smell bad. Anything that smells bad is probably bad for you too. Let me see if I got any more after that. Oops. No, I think that's it. Okay, so anyways, that's it for excitotoxicity and how to avoid it. Hope that was helpful.